My name is Dr. Aquina Thulare. I am technical specialist for health economics in the National Health Insurance branch in the Department of Health. For the G20, I have been running with preparing the program, but also chairing 3 of the sessions that were held during this 4th Health Working Group meeting. The first session that I chaired was plenary session titled Realizing the Promise of the WHO World Health Organization Pandemic Agreement and looking at issues of equity in, for, and through pandemic prevention, preparedness, and response. The second session that I chaired was plenary session 4, which is titled Science for Health and Economic Growth, Building Sustainable Domestic Science Ecosystems. This was followed by a co-sponsored, co-hosted event titled Harnessing Science and Innovation for Healthier Societies and Thriving Economies. And by its title, this co-hosted event really speaks to what was discussed earlier on in plenary session 4 on science for health and economic growth, building sustainable domestic science ecosystem. I will then go on to just highlight what happened during plenary session 3, which was dealing with the issues of pandemic agreement and the way forward in terms of looking at equity issues and how to implement the pandemic agreement. So what we did during this plenary session was to get inputs from the WHO, and we had an address from Dr. Mike Ryan, who is the Deputy Director General at the World Health Organization and also the Executive Director of Emergency Response Preparedness. What was important about the intervention of Dr. Mike Ryan was that from the start, he had been at the forefront of leading the global response to a COVID-19 pandemic, and also in response to many other global health threats such as mpox and other health threats that we had experienced as the global community. And Dr. Mike Ryan highlighted the journey that we had traveled and how this multilateral process of negotiation had ensured that the voices of everyone, whether you're from a small country or a big country, as long as you are represented in the WHO, you would have your voice and it would have an equal weight irrespective of how big or small your economy is. And Dr. Mike Ryan really thanked all the people who were part and parcel of the negotiation process on having managed to get to a stage where the 78th World Health Assembly adopted the pandemic agreement. In moving forward, we had one of our own, Professor Precious Matsoso, who was the chair of the Intergovernmental Negotiating Body, which was established through the WHO process resolutions and decision to be the body that is going to negotiate the clauses that form what is in the agreement. And basically what is in the pandemic agreement constitutes 3 sections. The first section is about principles, use of terms, and what we subscribe to in terms of what governs our meeting as the global community in a multilateral forum trying to address the injustices that were experienced during the COVID-19 pandemic. And then the second part of the pandemic agreement, it's about the equity provisions of the pandemic agreement, what we're trying to correct in terms of the injustices that were experienced during the pandemic, And the third part of the pandemic agreement, it's about the institutional arrangements that are going to be taken forward in managing the pandemic agreement, and how the provisions that are in the equity sections are going to be implemented. So that was quite interesting, because the journey from 2022 up to May 2025 was outlined, number of meetings that were held, the challenges in bringing differing parties together who were coming from different perspectives all together. The next section in the program was to deal with the way forward on what we are going to be doing as the global community after the pandemic agreement was adopted during the World Health Assembly that was recently held in May 2025. So during this session, we learned that there is going to be an intergovernmental working group that is going to be appointed on the 15th of July, and it will have all member states represented, and it will have a bureau that will also govern the interactions between member states in terms of guiding how we interact. But the role of this intergovernmental working group in earnest is to finish the remaining parts of the pandemic agreement that were not yet concluded during the previous negotiations, which is mainly what we call the pathogen access and benefit sharing annexure, where we are operationalizing Article 12 of the pandemic agreement on PABS, which is the pathogen access and benefit sharing system. And so we'll have to go through the negotiations of these PABs. Just to highlight that PABs is one of the critical elements of the pandemic agreement, and it's at the core of the pandemic agreement because it deals with how countries who are required to share in a rapid fashion information or pathogens that are causing threats should be reciprocated with benefits that should be shared out of sharing those pathogens or information. In the past, and during COVID-19 and in other health emergencies, we know that most of the pathogens are derived from biological materials that are residing in the global south, in developing countries. And people extract these pathogens and they develop vaccines and therapeutics and diagnostics out of them. But the countries that are originators of these pathogens normally do not benefit from what has been derived out of these pathogens. So at the core of this is that if ever a pathogen is accessed from anyone, those people must also equally share in the benefits of that pathogen or genetic information that is derived out of that pathogen. In that way, we create an equilibrium where originating countries do not find themselves last in the queue of getting benefits derived out of these pathogens and their information. So this has not yet been finalized, and we need to conclude the negotiations around that. What came out of that is that it is expected that at the next World Health Assembly, the PABS annexure would have been concluded, and will be able then to get the pandemic agreement to be ratifiable and to be domesticated by member states. So this is basically what came out of that, and experiences from negotiators who were involved in the negotiation of the pandemic agreement were shared with the G20 plenary session, and all of them brought different perspectives on how they viewed the negotiation process and their suggestions of how the negotiations during the Intergovernmental Working Group, IGWIC negotiations on the PABS annexure should proceed. Of importance, which we do not highlight, is that South Africa had been playing a critical role even in the intergovernmental negotiating body, the INB. The co-chair of the INB was Professor Matsoso, who is a South African, and South Africa played a leading role also in making sure that Africa presents a unified voice and to ensure that our interests as a continent are taken into account in line with our national foreign policy, that we take a posture of Pan-African solidarity. So that was also highlighted, that South Africa would not just negotiate on its own and leave its neighbors behind. No one should be left behind. So I think basically that's what we got out of this plenary session. And member states who made inputs after the information session were very, very positive about the outcomes of the negotiations on the pandemic agreement. And lastly, what was of importance also is that the UN high-level meeting in 2027 will also be looking at pandemic preparedness, response, and pandemic prevention, preparedness, and response. And it will be a review session to see what has been done since the last UN high-level meeting on PPPR, which was in 2023. And our G20 presidency will work as a platform to leapfrog the discussions that are going to go into the declaration that will inform the next UN high-level meeting. And very last is that it was also highlighted that with this pandemic agreement, the sovereignty of states is not subsumed under the WHO, meaning that member states will retain their sovereignty over their biological materials and over their right to implement national policies as they seem appropriate. Thank you.